Welcome, everyone. Thank you for being here. I appreciate your patience and whatever it took to get you present in the room. I
Um,
appreciate it. I am Almitra. I'm going to be leading the training, this workshop for the next 2 hours, maybe a bit shorter than that. And I appreciate all of your time. This is Understanding Violence as a Public Health Issue workshop. This is part one of a two-part series. So if you're not registered for part two, please do that so that you can get the link and the information for that. I think the link might be the same, but I think it might be different. So I will stay on top of the powers that be to make sure that that link goes out to you at a decent time. Okay. All righty. So you are in the right place if this is what you came for today. This training is open source. This training is available for everyone to grab the facilitator notes and utilize it in the way that I'm doing. You can train people on your own if you like. So I'm going to drop the link in the chat to that location where you can find this information. Let me just get that for you. Okay, so I got a whole bunch of links I'm gonna drop. So the persons on the screen work at the Multnomah Police, pardon me, Health Department, and they made this training available for the work that they do. They work with credible messengers, they work with community health workers, doing violence interruption work, and they made this. The version that I'm doing with you all today is a condensed version of the training. What you'll find in those links in that folder are um, the tools for a full 2 days in-person training. So that's not what this is today. We're getting like a condensed, modified version of that. But I think this is pretty good to get a conversation going. Of course, hey, Alexis, it's so good that you're here. I really would love if you put your phone or computer on mute, your mic on
Thank
mute.
you.
Hey,
What's
yes,
up?
I need you to mute your mic, Alexis.
Oh, okay, cool.
Yes, thank you, thank you. Okay, so the things that you all will walk away with today, some really good content, definition of the public health approach to violence prevention, being able to identify at least three different types of violence, and distinguish between institutional and interpersonal violence. Name social determinants of health that are risk factors for the exposure to violence, and always identify ways that we can continue to care for ourselves in this process. I have some agreements here that I'm asking everyone to agree to. So I'll ask at the end, but I'll read them through. For these 2 hours, my request, since we are all on video and this is a virtual session, is that you please mute your mic unless you're speaking. And so my request is that right now, since I'm the one that's speaking, that everyone else that's not speaking just press mute on your phone or on your computer so that your mic is not open. This is a bandwidth issue, right? And so typically when we're in meetings, people aren't on mute, right? People get to jump in and talk and say whatever they want. Except that here in the virtual space, all of the bandwidth that's devoted to your background noise takes away from what's happening on the screen. Or if it was someone speaking. So the rule of thumb is that if you're not speaking, that you go ahead and mute your mic. Share the airtime, please. Those of us that are really good at speaking in these sessions, just to be mindful that if you've spoken a few times, definitely make sure that there's space, you're allowing space for others to speak. So others might take a little bit longer and might not just be ready to speak right away. And so please share the airtime. A lot of times when we are in these sessions, we share things that are sometimes very intimate. And so this is the opportunity for us to share what we learned from those stories and not necessarily the story itself, right? And so we keep what's intimated and share any lessons that have come up. Today, we're going to be talking about violence, and we're going to be talking about all kinds of ways that violence occurs in our lives. So this is a brave space to contend with this problem, right? So we're not here to talk about people. We're here to talk about the issue. And there's plenty to talk about without necessarily calling out individuals. My request is that we be really impeccable with our words. I grabbed that straight from the Four Agreements, Don Miguel Ruiz. That just means to speak the truth and be kind when speaking the truth. Resist the urge to make assumptions and or draw conclusions. So in other words, just please be curious, ask questions, if anything. And when it's your turn to speak, I suggest strongly that you speak powerfully, right from the eye. Speak of your own experiences and the things that you have experienced or have read or researched in attempt to let's do our best to avoid generalization, such as, well, you know, when most people or when you, et cetera, et cetera. So those are some guides and agreements potentially that we can agree to make this session fun and interesting. And so is there any questions about these or things that people would like to add to this list? You like this so far? This is working for us? Okay, excellent. I will take your silence as consent. Thank you. Okay, so again, this is part one. So this is day one. Part two will be on Tuesday at the same time, 1 p.m. Eastern time. So we're going to get into some introductions in a moment. We just reviewed the agreements, and then we're going to get into defining violence and the way that we understand it, and then begin to look at public health and how it understands violence as a public health issue. We'll take a break, there will be a break. And then we'll end off by reviewing some of the social determinants of health, things that contribute to violence and exposure to violence. And always we will end off with talking about ways that we are tending to ourselves and tending to our personal well-being. So let me start with myself. I am Almitra Gasper. I sit at the Health Department for New York City. This training, like I said, comes from the Multnomah County Health Department in Oregon. I am the coordinator for the Strong Messenger Project at the Health Department. And so what that means is that we have teams of credible messengers all over the city that are working together and strategizing together to reduce the amount of shootings that are happening in the neighborhoods where they live. They work in many roles as outreach workers, hospital responders, violence interrupters, and all kinds of titles that they have given themselves now to do this work. I'm very happy to work with them. What I am responsible for is making sure that there is an assigned social worker to each team that we call credible clinicians that are like an extra member of the team that is only concerned with the team's well-being. So doing this work is a lot of exposure to a lot of things that might be triggering. People getting shot, people shooting each other, and all of the ramifications of that usually create some level of trauma, and we want to make sure that the worker can continue to do their work after being exposed to these things. And so they have a clinician that works with them on a regular basis in group sessions and works with the teams to make sure that the things that they're being exposed to in their work are not burning them out. So that's what I do. Now it's going to be time for everyone here to introduce themselves. So what I'm going to do is stop sharing for a moment. We have over 25 people in the room. And so we're going to introduce ourselves to each other in breakout rooms. And so let me see, I'm going to do roughly, you will be in pairs, so you'll have one other person to introduce yourself to. And then when we come back, everybody can introduce themselves to each other in the chat. But we'll give you a chance to do some personal introductions in your breakout rooms. Now, the number one thing that you're going to do in the breakout room is have a discussion about violence. So first, introduce yourselves, please, to each other. And then I want you to discuss with each other how it is that you define violence. So you're free to look it up. People, we Google stuff all the time, so that's fine. You can look it up in your dictionary and get like a formal definition. But definitely discuss with your partner, or if you end up in a room with 3 people, discuss with your partner the things that you would say are violent, right? And the things that, or the definition that you would have to offer. And when we come back, we will hear from a few people about that, what they came up with. Okay, so I'm opening those rooms now, and then I'm gonna create time. You'll have about, let's see, about 5 minutes for this activity. Okay. All right, and so everyone should just see something pop up. Okay, good, good. See you when you come back. All right, now what time is it? 1:31. Okay, so let me see. We got some folks here. All right, let me okay, breakout rooms. Everyone's in their breakout room. Make sure nobody's by themselves.
Hi.
Hi. Hello, Mr. Robinson. There you go. So, oh, hold on. Janaya. Come back. Peace. Hey, Janaya. I moved you back into the room with me because you was in the room by yourself.
Yeah, because I was just realizing, I was like, wait a minute, like, why am I by myself?
Hey, girl.
Hi.
How are you? You at the health department?
Yes, I work as an intern here.
Oh, welcome. So happy
Thank you.
that you and I get to link up. Okay, yeah, so I sit on 11. Let's see.
I'm on 8, but I'm supposed to be moving to 11 with my supervisor, I think.
Okay, all right. So, Janaya Taylor, how do you define violence?
So violence to me is not like only a physical action. It can also be like psychological. It can be mental. I think it's different types of levels, and it can vary in different types of impact. So like it can be like physical damage, mental damage, and it can come in any kind of shape or form. So it can be in a way where it's like something that doesn't seem like violence, but affects you in a violent way, if that makes sense. So that's kind of how I view it.
Yeah, it does. That does make sense, right? There's this range, right, of things that can be violent, right? And so sometimes there's a lot of focus on physical force, right? So that's one of the things that shows up.
Yeah, my person, Amitra, I'm sorry to interrupt, but
It's fine.
he had a bad connection and he dropped off.
Okay, so welcome to I'm glad you came back to the main room. I brought Janaya into
Hey, Janaya, how you doing, Janaya? It's good to see you.
It's good to see you too.
It feels like it's been a minute, right?
Right. It's been a minute.
because you know it's all right, so we got some people in the waiting room. I'm gonna let them come on in here. And
oh, this is Carlos again.
Carlos made it back.
Yeah.
So this is fine. Everyone can stay right here. You don't have to move. Hello, that's the sis from 100 Suits. Peace, sis.
Yeah, now I'm on the Zoom meeting once.
Now you're on the Zoom meeting.
Right?
Sir, Mr. Farr.
Okay. Just want to make sure, buddy. Just want to make sure. What's that? Yeah, great one is mine.
So I see our outreach supervisor from 100 Suits, one of our programs in Queens, Jamaica, Queens, has just joined us, and another one of his colleagues, co-workers. And I see Carlos Torres, Bronx
Hi.
DF.
How you doing? Are you able to hear
Program.
me?
I can hear you. Yes, sir.
All right, good. I'm sorry. The reason why I asked because I got logged into one of the breakout rooms, but I was unmuted, but no one's able to hear me. So
Yeah.
good afternoon.
Yeah, you had a little bad connection, but it's all good because you're here now.
Good.
Figured that out. Okay, so this is the group right here. The activity at this moment is to discuss how you define violence. And so Serena, James, Carlos, any definition of violence that you want to offer?
So for me, so good afternoon, everyone. My name is Carlos Torres. I'm the crime prevention coordinator, reentry liaison at the Bronx District Attorney's Office. Part of my role is building relationships with, queer violence organizations and reentry organizations, FBOs, CBOs. But definition of violence could mean a lot of things. For me, being born and raised in the Bronx for 20 years, violence will have to deal with, lack of education, opportunities. It can be folks who are impacted by violence directly or indirectly. So I would say violence could be indirectly or directly.
Thank you for that. Is there someone else that wants to contribute before I bring everybody back into the room? Definition of violence or the way that you see it? Okay, we're gonna get into it. Okay, so I'm bringing people back into the room to hear what they came up with in their breakout sessions. Okay, let's see, is everyone back? Yes. Okay, and so I hope everyone has some time to introduce yourselves to one another. Got to meet some new people, hopefully, and have a good discussion about how it is that you see violence already right now before we even get into this conversation. And so I would love to hear from about two persons. What is it that you discussed when you met in your breakout room? How is it that you define violence? Okay, Suzanne, put her hand up. Go ahead, Suzanne.
Hi, Almitra.
Thank you.
I was partnered with Martin, and we talked about how violence is an act of harm towards someone else, an interpersonal act of harm towards someone else, but that is not only limited to physical harm. That could be emotional harm, that could be financial harm, that could be mental harm. So anything that really causes trauma and damage and harm to another person is kind of how we defined it.
Excellent. Thank you for that work, Suzanne and Martin. Thank you. Okay, let's hear from someone else. Let me see. I see the drum crew in the building. I see y'all. I'm looking to hear from that crew and whoever else. So one other voice that we haven't heard yet. What did you discuss in your dyad? Don't all jump in at the same time. Go ahead.
Okay, I'll go. This is Gary Kelly. Hello, everyone. I was paired with Kelly. How ironic. We was kind of in awe at the fact that her first name is my last name. And also ironically and coincidentally, she's with Department of Health and Mental Hygiene and health, and deeply involved in community health related things. And I'm a community health worker at heart. Me coming from health people, previously before working for probation. I'm one of the community associates for Department of Probation, mentor coordinators, incredible messenger. So our interaction was more so in amazement and in our similarities, where we actually didn't even make it to talking about the different types of violence because we were just, we as community health workers, when two community health workers get together, that conversation tends to just the passion for making the community healthy, and we were just amazed at how the universe just paired us together. We shared this digital space, like this. So yeah, so
I love that
um,
story, Gary.
yes,
Gary,
yes,
you said
yes,
Gary Kelly.
yes, Gary Kelly. I met one other person previously whose first name was my last name, and 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 my first name was her last name
That's
because
amazing.
Gary Kelly is both a first name and a last name. So I
Yes.
had one other experience, and we joked around like, "Hey, if we were a married couple, your name would be Kelly Kelly."
Mm-mm.
you know, so yeah.
So who wants to talk about violence, right? You get in a room with people and then we start sharing all these other stories that we have in common. So let's see what it is that we're working with here. And this might sound familiar, right? This might sound like what you talked about if you did actually get to address the question. Violence. Mute your mic. I'm scared to speak. Okay, okay. So violence has traditionally been categorized or conceptualized as self-directed and interpersonal physical force, right? That's typically when we think about violence, we're thinking about something that's happening between people, or something that is someone is doing to themselves, and it usually involves some sort of weapon. And that weapon can be your hands, right? Or your feet, your legs, your head bunt, like this. So this is a typical categorization of violence. And then we are going to come and put on a public health lens, right? Or hat, and look at it a little differently and a little deeper, right? And so one of the reasons this is important to use this other lens is because from the public health lens, it really shows us that there's no single explanation for the continued problem of violence. So it's not just a simple thing that you can just say, oh, it's for this reason, and point to one thing to say why it's happening. So it's a little bit more complicated than that. It's a little bit more complex. Using a public health lens and or approach, it considers the aspects of violence that are not the responsibility of the justice system or law enforcement. And so I bring this up because typically when we talk about violence, we associate it with law enforcement, or we associate it with crime, or we associate it with some other thing that's not necessarily public health. Law enforcement is the most popular affiliation and association with violence and the idea around solutions, what it is that we are to do. And so I am highlighting this aspect because most of us are very much indoctrinated into the public safety approach, which traditionally has been more about retribution and less about restoration. And so I'm comparing these two approaches so that we can have a conversation about what's going on, just to give you an idea about what the public health approach is not, right? Based on how we understand something that is a mainstay in our communities. This is absolutely no shade to law enforcement, right? Law enforcement has an approach and it works where it works. And so let's just get into like the compare and contrast between these two things. And so public health tends to be more restorative, right? It's not really about retribution or payback. It's really about, okay, how do we heal what has happened here? And so public health tends to be treatment oriented, right? Looking for what is the treatment, and is not necessarily about punishment. When we take a public health approach, we are triaging the situation, looking to see how severe it is and determining, okay, what level of intensity do we need to meet with a cure, right? So there's triage and like patient intake, and not necessarily arrest and detainment. In public health, we are looking for like a diagnosis, right? And then prescribing something very specific for that specific situation and or individual, as opposed to a more systematic approach where there's like a set of sentences and that's prescribed for these behaviors, right? And so that's just systematic, not necessarily individual. What we find is that taking a public health approach leads to long-term behavior change, right? As opposed to short-term, right? And I think that that is the results that we want, something that's way more sustainable. And all of the choices and decisions that we make in public health is based on data, right? And so health screenings, environmental data, like all these things get taken into account, and not heavily influenced by social norms, right? It does show up in public health. But ideally, what it is that it works with information and not necessarily the whims or the feelings of people. So this is like the difference, or how we distinguish the public health approach from something that we might already know, which would be law enforcement and or more of a retributive approach. So I'm almost hesitant to move from here because I've done a lot of talking. Is there any questions or feedback on this before we get into more of the public health approach? Okay. So there are some activities that are associated with public health. These things, they sound familiar, I hope, to many of you, especially those who work at the health department. And we're going to review these things right now. And I'm going to ask some of you to read some of these slides if you can see them, and to give examples where it is that you are familiar and or know about these things. And let me see. All right. So I'm going to call on Janiyah, right? Because she's an intern at the health department, and you know, I'm more about the future. So Janiyah, can you read to us what health promotion is? Read for us, rather.
Sure. Health promotion is the process of enabling people to increase control over and to improve their health. Health promotion attempts to make the healthy choice the easy choice.
Yes. And so that, when we talk about violence, it's just like, oh, what's the healthy choice? But there are healthy choices. There are plenty of healthy choices. But this is exactly what the health department all across the country do, right? And so right now they are talking to people about getting a flu shot, right? That's the thing for this season, getting a flu shot. Stop smoking, right? And so all of the promotion that supports people to now, and I'm gonna focus on teenagers maybe, but maybe some adults feel pressure to smoke, to say, no, I don't want a cigarette. No, stop offering me that. No, I don't want that. Like it's not even cool. So something happened where we created an environment where saying no to someone offering you a cigarette is cool, and that's okay. It's like a healthy choice. It's much easier to make that choice now, as opposed to maybe before the peer pressure made someone feel that they couldn't do that. I think that wearing seatbelts is part of that also. At one point, if you got in the car, put the seatbelt on. I'm from the era that if you put the seatbelt on, your friends looked at you like, "Oh, you trying to say something about my driving?" And no, I'm just really in a motor vehicle and I want to be safe. But then they made a law They made the cops, okay for the cops to pull you over if they didn't see you with a seatbelt, and all of a sudden you'll put your seatbelt on, you will want to get pulled over. So it wasn't about safety still, or it wasn't about safety inside the car. But now, if I put my seatbelt on, no one's looking at me funny, right? Everybody has the expectation. And so it's just making the choice a little bit easier. Okay, so prevention, I'll read it because it's just one thing. Stopping the problem before it starts. That's exactly what it is. There's nothing to say more about that. An example about that I would highlight though is water filtration systems. And I really talk about that because we forget that that's happening and that the health department is doing that, right? That there are people that are considering the water supply in New York City and making sure that people don't get sick. So that's preventing a problem before it even starts. So those are two main activities that happen before there's an issue. And then we have these other activities that happen after, right? So after something has already happened and there is something we need to take some actions. And so let me see if I can get someone else to read both these slides for me, or both of these. Let me see, where is Jasmine? I saw Jasmine on here earlier. Get your voice in the space if you're available. No? Okay.
I'm here.
Oh, there you go. Okay.
Oh, you want me to read?
Yes, yes.
Okay. Sorry for the background because my team, we're all in one area. So I don't know if that's interfering.
It is.
Okay, I'm sorry. Maybe I am not the.
You know, I can't have you do it, Jasmine. You got to figure that out. So I'll take a volunteer. Wait, let me start calling people out. Michelle is laughing at us. How about you,
I
Hassan?
don't mind reading. Are we reading on the left side? We're on the left side, right?
Yeah.
Harm reduction, reducing the harm caused by a problem, and the problem does not go away.
Mm-hmm. And then what's curative care, Michelle?
Curative care, solving a problem after it already exists. That's the care part of curative, right?
There it is, right? And so harm reduction, this might sound familiar for those of us that work in substance abuse, or those of us that work with sex workers. So harm reduction is an approach that acknowledges that persons are going to make their own choices and decisions, that people are their own person and are going to get information and then make choices on their own. And sometimes it's based on the information, it seems like they ignored it or not. And so if we know that a person that, let's say, is struggling with an addiction to heroin, and the likelihood of them stopping using, actually, it would be harmful for them to just go cold turkey. We just acknowledge that there are things that they're going to do probably that put them at risk, and we want to reduce those risks. And so we say, you know what, come to this clinic and get clean needles and don't share your needles, right? So we reduce the risk of sharing blood pathogens and disease, right? Some persons go a step further and come off of heroin and get on methadone. So it's a form of harm reduction. So it's not perfect, it's not always ideal, but it acknowledges that people are going to make their own choices. And so you're probably going to continue to have sex for money because you need to eat. Our request is that you use condoms so that you are not exposing yourself and other people unnecessarily. I call what we do in Cure Violence a form of harm reduction, right? We don't always, and it's not always the right thing to say to an individual that is carrying a weapon or a firearm. They're usually carrying the firearm for a reason. So we don't usually say to them, stop carrying that gun. We can talk to them about the behaviors and all the things that go with that gun and encourage them to use it differently and think about how to carry it differently, whatever that looks like. And it's very individual. And so I akin that like relationship that we build with someone that's carrying a firearm in our neighborhoods. There's a way that we can encourage them to have different behavior with that gun that is a form of harm reduction. At least that's my interpretation. That's how I see it. Feedback, any other questions or comments about these activities and what you have experienced and or seen for yourself? Oh, you got your hand up, Janaya? You want to say something?
Yeah, I had a question. So could this, like the harm reduction, can that be considered physical and mental types of harm reduction as well?
I think so, but I want you to explain more about what you're asking about.
So like harm reduction is talking about like reducing the harm caused by a problem, right? So this can be like a physical problem, like someone getting physically hurt, or someone like dealing with physical violence, or like mental violence, whether it's like physically hurting yourself or like or being hurt by your like mental problem, if that makes sense.
Right. And so I think, yes. So now that I hear you ask it that way, I would say yes, that any behaviors that we coach people to take on that reduces the amount of harm that they're experiencing or reduces their risk of spreading that harm to others, I would say it's a form of harm reduction.
Thank you.
Hey, Gary, you want to ask a question?
Yes, I just wanted to say, y'all can hear me? Y'all can hear me good? All right. Well, harm reduction, if you've ever taken any type of ever taken any type of like a disease, STD workshop, HIV workshop, or anything, then you hear a lot about risky behaviors. All right. When it comes to risky behaviors comes in all different forms. All right. It doesn't necessarily mean sexual related. It can be drug related, as you mentioned earlier, using needles. Risky behaviors where you put yourself at risk, risk for exposure. You know, it can be risk for exposure to, you know, when it comes to drugs, it can be risk for exposure to some type of antigen, with sharing needles. Same thing with you know, with sexual contact. You know, you put yourself at risk for exposure to, you know, some form of a foreign invader. But in the sake of violence, you know, depending on how you're moving out there, you can put yourself at risk for exposure to a violent act.
Yes.
You know, so the harm reduction is that awareness of the things that you are doing to yourself that put yourself at risk for whatever type of exposure. You know, so as you gave your example, you're having risky behaviors by sharing needles. Here, we have a service for you that gives you fresh, clean needles. So you've just reduced the harm that you possibly and potentially doing to yourself. Okay, you're having unprotected sex. Well, that's risky behavior. So let me help you reduce that risk by providing you some free condoms. All right. If you're talking about violence and things going on the street level of things, well, here, you know, the way you're moving out there is a risky behavior to get your head blown off. So let me show you how not to get your head blown off. Here's the correct way to how you need to be moving out there.
Right.
Harm reduction, all different forms, shapes, and sizes.
Excellent. Thank you, Mr. Kelly. Perfect. So in public health, there is like an approach. So define, identify, develop, and scale, they pronounce it DDs. So I love this approach because I use this approach in my life. So yes, we use it in public health, but I'm like, oh, this is the approach I use for problems in general in my life. So in order to know what we're dealing with, we have to define the problem. When we started doing that work already at the beginning of this call, we took a moment to define violence or review our definition of violence. We're going to do more of that. And the health department specializes in defining things through the systematic collection of information. It's all about data. Let's go get data and let's get more data and let's analyze the data so that we can determine the magnitude and the scope and characteristics and the consequences. And we do that very well. And we're going to do some of that today and more of that when we come back on Tuesday. Then identify is talking about like identifying the root causes and the risk and protective factors. So what Gary was talking about was like risk factors. And then we're going to also talk about protective factors, things that might prevent things from happening or protect you if things do happen. And then also look into possible interventions. And then following up on that approach, we must develop and test strategies. So come up with some formula, some program, something, intervention, and test it out and see how it works. And once we really figure out something that really works, then to scale that up and across, right? To make sure that that's available on a larger scale, to scale it across sectors. Like there's all kinds of ways that we can use a solution once we find one that works. And then sometimes we might need to customize these solutions because not everything works for every single situation. In this presentation, we're going to focus mostly on define and identify. We will discuss some of the things that we have already figured out, solutions that were already working. Okay. So we're going to define the problem right now, though. Okay, so we started with skimming at the definition. And now we're going to get into a deeper, fuller, broader definition. So I have a definition on the screen here that's offered by the World Health Organization. And I would love for someone to read this for us so that we can all hear it. So I need someone with a good voice. Hey, Carl. Okay, that's you.
Oh, I raised my hand before you qualified that. I don't know if I have a good voice or not. Sorry.
Well, you it now, so let's do it.
All right, I'll give it a shot.
Yeah.
The World Health Organization defines violence as the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community, which either results or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation.
Yeah, so that's different than what we kind of was talking about earlier. Carl, what do you think about that? Is there anything that stands out to you from that definition?
I think it's largely similar. It's, you know, it's a little bit more expansive in terms of talking about more than just injury, but psychological harm and deprivation. But I think the gist of it is the same in terms of physical force and resulting in injury.
Okay. Yep. Yeah. We heard physical force earlier, and then resulting in injury for sure. So thank you, Carl. Was this?
Oh, I guess the other thing that's distinguishing is this specifies against oneself. We didn't really discuss that before.
Right. Okay.
What about the word intentional? I mean,
I'm glad you said that.
Do we look at violence? I mean, to be fair, all violence isn't intentional. I would say 90% of it highly is, but all violence is not intentional. So how do we define that? How do we redefine that to where it's not looked at as this type of violence?
Okay, so that's a good issue that we can wrangle with in this session and the next. Like, how do we account for things that occur as accidental, maybe? You know, Gary, you wanted to respond to this? You see something in here?
Oh yeah, I just wanted to ask if he could say that definition again. You know, certain pieces of information, I like to hear it more than once.
Yeah.
You know, I just want to make sure, you know, I heard him right within that definition. So I just want to ask if he can repeat that again.
Yeah, you perfect. I was going to ask someone else to read it again. And so Hassan, you want to take that on for me?
Sure, no problem.
Sure.
I don't have a distinct voice, but I'll go for it. The World Health Organization defines violence as an intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community, which either results or has a high likelihood of resulting in injury, death, physical, psychological harm, maldevelopment, or deprivation.
Mhm. Thank you, sir. Did you want to say anything about what you heard, and then we'll get to Amber?
Oh, no, y'all can you can keep going.
You got, okay, good.
Yeah,
And any feedback on that, Hassan, around what you read?
Yeah, I was looking at that word intentional, like the brother had mentioned. Sometimes I think violent is not, but I'm gonna just say simply, it could be not as intentional. It could be sublime in a sense. It's not always intentional.
Got it. Hey, Amber.
Hello, everybody. Good afternoon. My name is Amber. I had to say something because the word intent, I raised my hand, I unmuted myself. I was like, I need somebody's attention because I have to say something. Intentional. Now, this is the problem, and this is why laws like the 3 strike laws and undetermined sentencing became possible, because we think that violence is intentional. Some violence is not intentional. You have to think about and even consider the mitigating factors that happened prior to that person doing what they did. Trauma is a very, very big factor. If, let's say, 2 people in an argument and one person ends up catching a manslaughter case because they hit that person too hard and the person ended up falling and banging their head. If you look at that person's life story, that person's life story might be, oh, they come from a DV case. They were abused as a kid. They could be mentally have a mental disability or mental challenge. There's so many things that you have to consider before you just say, okay, the reason why this person used physical force was because they wanted to intentionally hurt somebody or intentionally hurt themselves. People that slit their wrist that's not an intentional thing. That's not, I don't want to say normal, but it shouldn't be normalized. They're not purposefully doing that because, oh, that's today I want to do that. No, there's trauma behind that. There's mitigating factors. There's something behind that needs to be unveiled. It has to be spoken about. And that's why a lot of the times when it comes to mental illness or people with mental illnesses in New York City, we end up calling the cops and we don't end up knowing what to do with them. They don't get the proper care. They don't get the proper resources. We don't know what to do with them. And that's why the mayor just passed down that law, or I want to say that committee, where now they're going to train people to know what to do with people with mental illnesses, which I don't understand why it took so long, but that's just a sidebar. And that's my little P's and Q's on that.
I agree. Why?
I concur.
You didn't have to take this long. Okay.
Listen, I knew that answer. I knew the solution to that problem in maybe the 6th or 7th grade, the first time riding the train, like by myself. I was like, okay, why is the police officer dragging this man who's yelling and screaming on top of his lungs, talk about, don't touch me, don't hurt me, my skin's on fire. You know something happens to that man. He's talking like a kid, switching personalities. You can clearly see that there's something going on there. You call the police, you got them dragging this man by his ankles out the train.
Right. And it's unfair to the police that are not trained for these situations.
Of course.
It's not
they didn't get the training.
It doesn't match up, right? And so
not at all.
I want to draw attention to intentional the way I see it, right? So I'm hearing some things here. And so this just simply says that if you use physical force or power, right? And so I can use my brawn, or I can use my ability to leverage situations because I have access to resources and power, right? If I use that, right, and I threaten someone, or I actually use it against myself or another person or a group, and it results in or has a high likelihood of resulting in serious harm, injury, psychological harm, all of that, right? Then that is violent. And so if I am using physical force, right, and I'm just trying to move something, right? I'm using a lot of force to move something and someone ends up getting hurt, I don't think that that qualifies according to this definition, right? But if I am using my power and someone ends up getting hurt, whether I was trying to hurt that person or not, that's violence. That's how I understand it according to this definition. So there's a lot of ways that we could pick this apart, and I'm going to move us on to the next slide because you think this is going to get conversation going. Wait till we come here, right? And so let me get somebody to read this one for me. Okay, you want to read this one, Gary? Can you see that one? So you put your hand up. Did you want to read this slide, Gary? Yes?
Well, yeah, I'll read the slide.
And then say whatever you want to say. I know you want to say something. Go ahead.
Okay, where we at? Where's the slide at? Okay. What is structural violence? That slide?
Yes, sir.
Okay, what is structural violence? A form of oppression opposed by mutually reinforcing systems, including social, political, and economic, which prevent individuals and communities from having full access to resources and expression of their rights. Let me read it again.
You could, or you could just give me your feedback, what it is that you want to.
Okay, now I'm gonna read it again because somebody probably went to hear it a second time.
Okay.
Okay, what is structural violence? A form of oppression imposed by mutually reinforcing systems, including social, political, and economic, which prevent individuals and communities from having full access to resources and expression of their rights.
Yeah. So what do you think about that? You're gonna pass it on, okay?
Yeah, I'm gonna pass it on first, and then I'll swing back. Yeah.
I for one would agree with that 100%. I think the political policy of benign neglect actually proves this as being 100% on key, because that is exactly what the benign neglect in our communities did. So I would say 100. I'm with this. This is accurate.
Yep, that sounds about right to me. Other feedback to.
Okay, I don't know why the first thing that came and popped in my head was prison.
Why prison?
Huh?
Yeah, well, say more.
Prison?
Yeah, say more.
Yeah, it's no secret that individuals serving time in prison, experience so many different forms of oppression. I mean, you talk about mutually reinforcing systems. It's really nothing. It's really nothing more that really need to be said. Just prison. The New York. I'm not just the New York State prison system all over the U.S.
Yes, sir.
And more oftentimes than not, when you have a prisoner that's that's attempting to bring light to some of the things that's going on within the prison that they're serving their time in, it's just like it's just a recipe for disaster for that prisoner. That's the system. That's the system. You got the officers and everything. They don't like, oh, you trying to blow the whistle on this, and they'll figure out some way to further oppress you and quiet your voice.
Yep.
Which is the reason why I've never referred to a person who's incarcerated as an inmate.
Raise your hand.
I always refer to individuals incarcerated as a prisoner, because a prisoner is a person that's being held against their will, and nobody wants to be incarcerated. So you're being held against your will.
Is that right?
Because there's a difference in the definition between a prisoner and an inmate.
Yeah, so you saying?
Yeah, I believe he's right.
You saying that
the ones who submit.
in penitentiary you against your will? Huh?
Yes, it sounds like that's what's being said, brother.
Because what happens is that if we commit a crime, you do the time, right?
Right.
Everybody's not guilty. I mean, everybody's not innocent.
No, not everybody, but
So,
not everybody is guilty either.
Exactly.
Right?
I understand that.
And the reality is that the persons that are incarcerated have been placed there, right? And so it's okay to call them prisoners. I agree with calling them a prisoner, right?
I think what the brother was saying.
Because even if I intentionally commit the crime, I still don't want to be in prison. They just caught me.
But you knew the consequences.
And I wasn't
the consequences
able
though.
to break out the shackles.
That's a maybe. And so
But that's a
this
key
is a-
pivotal point in the conversation, because
Yeah,
that's
it's a
exactly
great
what he's
part.
saying.
Exactly.
A prisoner is someone who didn't agree to doing the time. He's taken there. He's against this whole system. Whether or not he's guilty or not, doesn't matter. But an inmate, if you look at the defining word of it, is someone who agrees to the time. These are cop-out, these are pleas. So that's what he's saying. They both may not want to be in that environment, but one did agree to go. The other one said, I'm going to trial.
You know what?
The thing I want to draw attention to is this
Since you put it that way,
mutually reinforcing thing that's happening, right? There's multiple systems at play. And so the Amber had brought up, there's other things that's happening. So your person that ends up being an inmate or prisoner, take your pick, whichever way you want to call them, already went through a series of systems that landed them there, right? They didn't get to that system without other systems playing a role, right? And so that's what we're talking about, the mutually reinforcing systems that create the impoverishment and the hunger that creates the ribs to be touching, and now I gotta go rob something. Like there's a whole bunch of things that happen. So Janiyah had her hand up, but before we hear from you, Janiyah, because we heard from you, I want to hear from the crew in Brown. I think y'all in Brownsville. Drum folks, I see the hand is up. Was it somebody wanted to say something from that crew?
Yes. Looking at the second line where it says including social, political, and economics. When those things are deprived in poverty communities, it leads to, the brother was saying, someone committing crime and going to prison. So these systems are designed to keep their system functioning, where the judges still get paid, police officers still get paid. So those are social systems that set up and designed for poverty communities to keep suffering, and that's when the revolving door and the person constantly being incarcerated. If they don't elevate their minds and try to do something socially in their communities to make that change, these systems stay in that design. We hope it thrive in that design and be in prison.
Thank you, brother.
Hey, I just wanted to piggyback off of that. I'm sorry. It's like three of us in the same room, so it might echo. But also, the government places guns in our neighborhoods to keep their system going. They put guns on freight trains for people to steal. They put those in our neighborhood so violence can continue. So that police, as he said, so that police officers, judges, and so forth could still have a job, because without creative violence, they would have nothing to do.
Thank you, Raven. Janiyah, you wanted to say something?
Yes, I wanted to say something briefly. I was just going to say that I think prison is considered structural violence because it kind of touches on social, political, and economic, because it kind of does all those things. But I think also thinking about trying to find a solution, I think it's kind of corrupt in that way, because the prison system kind of doesn't support prisoners to get them the resources to not commit violence again. So when prisoners are released and they have like minimal resources to like get jobs, to like kind of put themselves back in society, they end up reverting back to other ways of violence, which puts them back in the prison system that keeps them fueling that. So I think like prison is definitely a version of structural violence, because it kind of keeps people who are in that system like rotating in and out without a way for them to properly like not be a part of that anymore.
I'm gonna put it as devil advocate.
Go ahead.
When you fed up, you fed up. You gotta want to change. You gotta want to change. You can't depend on nobody else, because they ain't gonna do nothing for you.
So that's is this your experience? Because
experience, yeah.
Yeah, speak about you, like your experience.
Me, this is Mrs. Spell, right? I did 26 years in the penitentiary. I work for Department of Probation right now. I knew I had to change before I got home. I knew I didn't want to go back to crime. I didn't want to do none of that. That wasn't me. That's something I got into. When I look back on my history of how I grew up, I had a mother and father, I had a good household. Nobody had the best household, but I decided to go to the left. So I had to make a decision to go back to the right.
Right.
So I know I want to go. You can't change without changing with yourself. One thing I learned in life is you cannot be free without liberation. You gotta liberate your mind.
Yeah, but you do agree that you had to get to that point before you came to terms that you had to make that change. You see,
right, but nobody gonna make a change for it. We keep looking for
the system. At that point, the system had already done what it needed to do to get you there. It's that when you got to that point, you decided that you're not going to be manipulated by the system.
I'm gonna take my own stripes. I committed a crime to get to the penitentiary.
Right.
Yeah.
I committed a crime.
Thank you.
Right. I committed that crime to get to the penitentiary.
Yeah.
I understand the rules of the game, so I made a decision. It's like we don't know. My job was to do what I did. The police.
Right. So you did some things and it landed you in a place, and then you had to make some other choices to get you out of that. Right.
Exactly.
And so I hear that, brother. Thank you for sharing
exactly.
that.
Very much so.
We are living examples of the work.
Yes.
Right?
Yes.
And I think what James was referring to, and we're going to get into this conversation right now, like there's a whole bunch of things that we see, right? We see self-directed and interpersonal violence all the time. This is the easy thing to identify. But then there's some things that's under the surface that we might not see that, you know, after spending a decade or so in prison, we might recognize like, oh my goodness, there was a lot of stuff that was going on. I made my choices, but there was some stuff. So now that I'm clear about the stuff and I don't have to choose that, I could choose differently.
There you go.
Here we are now. We want to make sure that we can have this same conversation with people to prevent them from getting and having to do 20-something years. You know what I'm saying? And so what are some of these things that are happening beneath the surface? Structural and cultural violence is happening beneath the surface. And until we come to a workshop like this and call it out and actually give it language and give it credence and say, yeah, this is happening, it's going to just continue to bubble under. Well, and we're going to continue to see some of the results that we're seeing, right?
Well, a lot of us, I'm sorry.
Hey, may I say something?
What happens is this, is that we have to teach our young people how to communicate.
All right, so I'm going to put a pin in that because we're going to get to that. Let's hear from the brother. I think that's it. They wanted to say something.
Yes, it's Mr. Robinson.
Mr. Robinson, and then we're going to continue this conversation. Don't go nowhere, Mrs. Spell. Go ahead.
Okay.
Yeah, just speaking from everybody, you know, aspect, tying it in, but also I have a background in sociology, so just trying to incorporate that. It was a theorist, Emil Durkheim. He proposed that the structural functionalist theory. Basically, he stated that a lot of the things we see, the phenomenons, the violence, all this stuff is just a synonym or a symptom of, I mean, not a synonym, a symptom of society flaws. So as Ms. I don't know how to pronounce your name, Almitra, correct?
Okay, Almitra.
As you were saying, like, you know, it's a deeper surface below it. So everything we see, people going to jail, people just violence overall, that ain't nothing but a symptom of the, you know, the macro level of what's really going on. And although it's macro, it's really a micro, you got to look at it as a micro level, if that makes sense. But at the end of the day, everything have to be a balance, because as someone said earlier, there's no jobs without crime. You know, crime pays, and that is true. Crime does pay. It's as in school. Certain institutions, like the educational institution, the older I get, I understand that they not really caring that you missing education. They caring that they're missing payments, because when you're in class and taking a seat, you're actually is a dollar sign, because the more you enroll, the more money we get to keep our institution running. So at the end of the day, everything is a balance. You know, you have to have a balance, and a lot of those phenomenons we see do come from the falls of society.
So how do we prevent that?
So hold on, Mrs. Spell. because
Okay.
this is one of the things that happens, right?
Yes.
Once we say, oh, that's the problem, let's fix it and hold on, because it's like 20 something of us here and we've heard from you. We need to hear from other people. We actually need to take a moment and actually see what it is that we're dealing with. And so right now I'm going to break you up into breakout rooms if we're just for a few minutes, you don't have forever, to identify the ways that structural and cultural violence are operating, whether you've witnessed in your life, you're experiencing it right now, something that you want to call out. Like I will give you examples, right? So an example of cultural violence is obey your husband, right? An example of cultural violence is I wear a wife beater rather than saying I wear a tank top. So these are examples of cultural violence that just exists. Structural violence, there's all kinds of examples that you already gave. I don't have to give any more examples of that. But you are going to get an opportunity right now to just identify and call it out. The ways that reinforcing, imposing systems of oppression are in operation. And I'm giving us this moment, Mr. Spell, to take a moment to look at that, because some of these things that have to be considered, because this issue is complex. So very simple explanation and there's no simple answer, but it does require all hands on deck, right? It requires multiple minds to be paying attention to it. And so with your permission, can we do that? Can we do that now? Can we get into the breakout rooms? I got no problem sharing the space, sharing the love. Okay, so these, no. Recreate these rooms. Whatever we did before, we're not going to do that again. Okay, and so let me see, there's 20 of us. All right, good. Okay, so you will have virtually no time to do this. So I'm going to give everybody 4 minutes and then we'll take a little bit of a break. So you can take a little bit longer if you need to. Create a list of things that you can identify that are structural and or culturally violent that you would like to call out. So those of you that's working in a group, right? You got a whole crew of y'all in there. Do that with your group, okay? I can rearrange the rooms to make it easier for people to do that. So just do that with your group if you're already in a group space. But if you're not, if you're just joined in on the call, go into a breakout room, you can work with somebody else. 4 minutes. Do that now. All righty. Let me see, who do I have left here with me? Everybody got a room? Everybody got a room. Okay, Janaya joined in with them.
Justice March is about the intersectionality of oppression. It's about people understanding that we are connected in our struggles. We want to see leaders in food injustice. We want to see leaders standing up to stop mass incarceration, gender discrimination, because the fact is, all of these oppressions, they intersect. Equity is everybody's fight. Come out on October 10th, 2022. See you at the Barclays Center, downtown Brooklyn, to stand up for human justice. The Human Justice March is about the intersectionality of oppression. It's about people understanding that we are connected in our struggles. We want to see leaders in food injustice. We want to see leaders standing up to stop mass incarceration, gender discrimination, because the fact is, all of these oppressions, they intersect. Equity is everybody's fight. Come out on October 10th, 2022. See you at the Barclays Center, downtown Brooklyn, to stand up for human justice. The Human Justice March is about the intersectionality of oppression. It's about people understanding that we are connected in our struggles. We want to see leaders in food injustice. We want to see leaders standing up to stop mass incarceration, gender discrimination, because the fact is, all of these oppressions, they intersect. Equity is everybody's fight. Come out on October 10th, 2022. See you at the Barclays Center, downtown Brooklyn, to stand up for human justice. The Human Justice March is about the intersectionality of oppression. It's about people understanding that we are connected in our struggles. We want to see leaders in food injustice. We want to see leaders standing up to stop mass incarceration, gender discrimination, because the fact is, all of these oppressions, they intersect. Equity is everybody's fight. Come out on October 10th, 2022. See you at the Barclays Center, downtown Brooklyn, to stand up for human justice.
He was arrested in a tank top.
Right, exactly.
It's about
exactly. And someone came up with the word white
beater, and that don't even originate for us.
Exactly.
Different.
Leaders standing up to stop mass incarceration, gender discrimination.
A lot of things we learn, a lot of things that we wear, a lot of things we think came from European thought. We white beaters back. We didn't have tank tops back in the day. I mean, tank tops. No. We didn't have that. We didn't wear that.
For human
we learned that. And what I'm upset about is that we don't support our own when it comes to political, social. We wear somebody else's clothes. We clearly somebody else's clothes. We getting them rich. You know, a lot of these brands are owned by owned by the Klansmen. You know, last time we wore 8-ball jackets back in the day. Some sneakers. Oh, we go to sneakers again. Had the Confederate flag on it. What's the name of sneakers again? Had the Confederate flag on it. The sneakers back in the days.
Reebok.
Reeboks, owned by Klan. And they started 8-ball jackets came out because somebody won a lawsuit against the Klan, and they came back out with an 8-ball jacket, with $1,000 8-ball jacket, and we killing each other over it.
Definitely have friends.
I can't go to Macy's and say I'm $1 short. But so we each other, yo, bro, I only got $8, but it costs $10. Come on, brother. Come on, sister.
Yes.
We exploit each other.
And then it's also even a bigger international level where ones they can come, you know, to the USA and they get money, they get loans instantaneously, almost just for, you know, they want to open up a business. As far as someone in our own community, you know, want to do something like that, there's so many guidelines, roadblocks that we have to go through. And now we the same ones going to that gas station, going to that Macy's, and we short a penny, but we go to them every day. And when we
So
show
that
the
sounds
penny,
like, it sounds like deprivation, right? It sounds like
Yes.
the definition
A
that we
prime
were talking
example
about
is all
earlier.
of these new dispensaries here. They won't give Black people a loan to get no dispensary.
yeah,
If Black people have to go to another state just to even get a dispensary license, they won't even give it to us in Illinois.
And in New York.
So they have to go to a whole nother state just to get a license, and then that license is only valid for their state. So then they
Ain't
have to
that
migrate to
something?
that state in order to make a dispensary. Where as now dispensaries are, we got a dispensary in every small city in Chicago now, in Illinois, all around. And personally, me from working from a bank, I have seen many Black people have that at their first hand and get denied for loans. And then I also seen a white gentleman come in and get approved. He didn't have to go through no hurdles and no leaps to get the license.
That's
Yep.
structural violence, right? That's a great example, Raven, right? I hope other people brought up like the economic issues of not being able to qualify for loans simply because of how you look, right? You didn't even look at my application yet, right? Other examples that you talked about in your groups of structural and or cultural violence. And so when we came, I heard some people talking about how it is that we're referring to our clothes, right? So that's an example that I gave. The term wife beater doesn't come from us, but we adopted it and we kept taking it on and carrying it on, and like children are saying, wife beater is bugged out, right? What are other things that you talked about in your session, in your breakout room, that we haven't heard yet? Structural and or cultural violence.
Well, I look at structural violence, I think it's being policy, political, because it's attached to policy. And that's usually where it starts at right there. The idea put on paper, then it's formulated, put in our community. So structural violence to me comes from policy.
Are there policies that you want to call out that are violent?
Yes, I would say if you want to look at the Rockefeller drug law policy, when that was the policy, that was structural. You could look at the benign neglect policy. That was the strongest policy of all policies, because that right there took the resources right out of our community, closed up firehouses, reduced the police department, killed the resources from coming in the community so that the buildings became dilapidated. You had no way to renovating the community and building it back up. So that was probably the best policy, strongest policy I've seen effectively today.
Yep. I've seen. Yes, sir. Thank you for sharing.
Yes, I just want to, I'm sorry.
No,
I
you
want to
can go ahead.
piggyback off of that as well, because now as everybody probably can see in the news, Biden is pardoning all marijuana convictions, and everything that's going on with marijuana now is being pardoned. Whereas it was fine when Black people were going to jail for it. It was fine when people of color, not just Black, but any people of color were going to jail for it. But now that the white people want to get into the weed industry, they're pardoning it so that they don't get in trouble and don't have any issues legally with it. So that's a whole nother form of structure as well, because we were just oppressed about this same subject, and now it's okay. Now it's looked upon as a business idea, whereas from the beginning it was just used to put us in jail.
Right. You was a whole criminal. All right, go ahead, Gary.
I don't know the person I was just in the breakout room with. I didn't catch the name. But she came up with
me.
It was who?
It was Raven.
It was Raven. Okay. Yeah, Raven, she came up with some good points. She brought up in some cultures, you have forced marriage at an early age, where you have kids that are being forced into marriage and sexual relations, as a form of cultural, which could be a form of cultural violence. And she also identified the healthcare industry as a form of structural violence. And I already, brought up prison, and we already expounded on that.
But I would like for her to, to speak about her, her perspective, with these 2 points right here.
Thank you, Gary. So I have the crew in Brownsville, and then the sister, it says ML, I'm sure your name is the name. So when you come on, please tell me your name so I can refer to you properly. But let's hear from the crew in Brooklyn. The drum. Who wants to talk? You want to say something?
My name is Doug from
Hey, peace.
I just wanted to point out one of the biggest forms of structural violence against us in particular is the education system. Because we getting taught a history that's not ours, and overall the United States reads on a 8.5 grade read level. So that means the average person that you talk to thinks like a 14 or 15-year-old. So that's a violence against us because now we're not able to actually grow intellectual as we should.
What's the solution?
Agreed. We're gonna get to solutions. I know you want the answers to fix the problem today. I got it.
No, not necessarily, because it's gonna take time. We understand
It's gonna
that.
take time. All right. So then look, we appreciate your patience, brother. Let's hear from the sister. I think she went to unmute herself, and then what happened? Okay, was it somebody else?
Yeah. Oh, I'm sorry.
Okay, I hear you.
Yeah,
now.
I forgot. I'm sorry, I forgot to unmute. My name is Claire
Claire.
McLevain. When I heard the term structural violence, it made me think of an actual structure, and it's policy related, it's urban planning related, and that is the construction of major highways. And I'm thinking in particular of the Cross Bronx Expressway. I live in the Bronx. And these highways were built dissecting neighborhoods of color, particularly Black neighborhoods, not just in New York, but throughout the United States. And when that happened, and it was done purposefully, when it happened, it destroyed homes, it destroyed businesses and entrepreneurship. It made those communities less desirable to live in because now all of a sudden, you have a major highway running through your community. So now, even today, decades later, generations later, because of the vehicular traffic, people have higher rates of asthma and other respiratory diseases. You don't have, desirable places to live, and you can't get from one end of the Bronx to the other without going, from one side of the Bronx to the other without going north or south. So who wants to invest there? Who wants to live there? Who wants to build beautiful homes there? And it is structural in more ways than one.
Yes, Claire, thank you for bringing that up and bringing that into the conversation. Many of us that live in New York City have no idea who Robert Moses is, and who it literally changed the landscape of New York City to create it so that rich, well-to-do, affluent people could travel into the city, in and out of the city, without having to see any poor people, right? To do the research, Robert Moses, urban planning for New York City is a whole degree of study. So Celine had her hand up. Let's hear what you want to offer, Celine.
Just to add on to the structural violence, because I also visited this subject in school. And I realized that when we were doing community assessments and differences from, let's say, more desirable areas in New York City, the same thing they did with the highways, they did with the MTA transits, where mostly in the Bronx or in what you would call quote unquote ghetto areas, the trains are exposed, as opposed to once you go downtown or into the city, they're all underground. So I just wanted to add on to that as well.
Yep. Great, astute observation, Celine. Excellent, excellent. So this is great work, right? This is the work, right? I know that we would like to get the answer to how to fix it, and we will when we actually dig into talking about it. I'm hoping that some of the things that you heard today so far are things that you like, either you knew, or this is familiar with it, or it's just brand new and now you have some work to do, right? To actually understand what it is that we're dealing with, because none of these things happen by accident. There was an intention around building highways through entire communities, as Claire said, and it didn't just happen in New York City, it happened across the country. So that's a strategy, right? That's what we call a coordinated attack. And so structural violence is at the top of my list here of types of violence, but all of the things here can be seen interplaying in this with each other. So war is the obvious problem, right? But then there is sexual violence that happens with war, right? And so you don't see sexual violence on the list, but it's included inside of wars, included inside of ideology motivated violence, the idea that I can take it if I want to, right? That's rape, right? Whether it's man or woman, that's an ideology that somebody is holding on to. And then community violence and family and intimate partner violence, which we will discuss a little bit more on Tuesday, usually follows a pattern. And it usually exists inside of areas that are experiencing extreme impoverishment. Anytime you can't put anything together to get food on the table, there's going to be some frustration. And a lot of times that ends up as violence in households. And so I want to move us into social determinants of health, because we are going to, even though we started late, I'm going to try to end this on time because I appreciate everybody's time. It's Friday. Some of us have things that we want to do at the hour. So the point of spending time looking at structural violence and unpacking it and identifying how we have witnessed it and how we might be experiencing it is because all of those things show up on our health, right? And so it just doesn't happen and then we just live with it. No, it actually happens and we manifest it as a health condition usually. And so Claire made a great point. She said, okay, we put these highways up. And so now with all the islands and the problems, and now the Bronx and Manhattan are top of the list for asthma rates, for our babies, for everyone that lives there. And that could have been avoided maybe, or maybe that was the intention in the first place. I don't know, but we're going to keep talking about it. And so there are all kinds of things that show up in our lives that impact whether or not we end up healthy. Education and employment is inside of socioeconomic status. I think someone talked about, thank you for raising that, whoever that was from the drum. You said your name, I can't remember it right now. But if we are teaching everyone to read at an 8th grade level and we're saying that this is top, this is the height of it, then what is all this other stuff that we're doing around higher education and all of that? What are we really up to? Some of us get to have access to education at a higher level and some of us don't, or we just keep everyone at this level, right? And some people at this level so that we can continue to pull the wool over people's eyes. There's something that's going on there. Mostly the people that have more money get more access to education, right? So we don't live in a meritocracy. We don't live where just because you are good, you get good. That's not what's going on here. We live in a different situation altogether, and based on the resources that you're born with or the family you're born into, all of these things determine what sort of access that you have. So I asked very specifically for the policies. Thank you, James, for saying Rockefeller drug laws, right? There are policies that have been in existence, so that law is not in the books anymore, right? But that's not helping me, right? Because my cousins already did a gang of time based on those laws. And so all kinds of housing, civil rights, education, criminal justice, and healthcare policies have an impact on our health, right? So it's not just an impact on like how we experience life, but it actually shows up on our health. And so the environmental racism, Claire, when you mentioned that thing about the asthma, that's a form of environmental racism, right? Anytime there are groups of people that are living in an area that's highly congested, right? And then they are subject to constant exposure to toxins, constant exposure to violence, constant exposure to structural problems like dilapidated housing and the like. This is a form of environmental racism. And in this country, you think what you are witnessing in the Brooklyn and the Bronx, Harlem, and parts of Queens and Staten Island, this is not unique. This is what it looks like in cities all over the country, right? And we got some people that's not in New York on this call right now that'll attest. Like, it's a problem where I live too. So if that's the case, then we need to really look at the issue, because it's not individual. It's not just happening right here. I can't just fix it with a solution for right here. I have to look at the entire issue that's going on. And so there's a lack, or has been a lack, of cultural cohesion and community order. But I have a feeling that that tide is turning, right? Because where I live in New York City, we got bands and teams of credible messengers that's really about that work and putting it in and out here helping participants and high-risk individuals make different choices. And then when they make those different choices, it gets easier to make the different choice again and again. And so we're changing lives. People are getting back in school. People are finding work, finding, what's they call that, employment, gainful employment, right? People are becoming entrepreneurs. So there's all kinds of things that we are doing to combat this. Someone was asking for a solution. We're not there yet. So this is just more about social determinants of health. Violence begets more violence. I really want to end with you all by talking about healing and resiliency as part of the solution. So what is it that you all are doing or have plans to do this weekend to help you contend and stay in the fight, right? With the work that we're doing. When we come back on Tuesday, we're going to review all of this stuff and we're going to get into exactly how this stuff shows up in your health. It's a subject called epigenetics. You might have heard that term before. It's not as complicated as it sounds, trust me. It's just, if you ever heard any elder in your life say you are what you eat, that's epigenetics. That's all it is, right? I will send out some links so that you can brush up on the topic in preparation for Tuesday if you want to, but you don't have to do that. This topic is something that we can all come to, however it is that we want to come to it. And so self-care, resiliency, healing and resiliency. What is it that we are already engaging ourselves in on a regular basis to make sure that we can continue to fight the good fight? I'll hear from anyone. I see Church of Holiness got their mic open. If you want
Sorry
to say
about
something.
that.
No, it's fine. Please say something and tell us your name.
Oh, my name is Sophronia King, and I'm a mediator. So I have been training to combat problems concerning justice-involved individuals and people who are victims. So victim and justice-related concerns. I have been training to stop those sort of disputes. So I'm actually learning a lot from this training here. And I hope that I can be able to work with some justice-involved individuals on many different disputes so that we can solve. We're talking about solving problems. So I see that as a way to solve some of these problems in society.
Well, thank you. Say your name again.
Sophronia King.
Sophronia. Oh, that's a great name. First of all, thank you.
Thank you.
Thank you for being here. And you are in the right place because you here with a whole bunch of mediators, violence interrupters and outreach workers.
Yes, yes.
To resolve conflicts. So how do you maintain yourself, right? Because this work can be stressful. So what is it that you do to take care of yourself? Please share that so that the people can hear some examples.
Well, right now I am taking it easy, just being in nature. So I find being in nature to be healing. I used to live in a part of New York City in Queens where it was, I was by the beach. So I would say I'm a survivor. That's number one. I'm a survivor of trauma and abuse. And healing by nature is one of the best ways.
Nice. Excellent. Thank you for sharing that, Sophronia.
You're welcome.
And so before we wrap up, I wanted to hear from anyone else that didn't get a chance to speak. If you have some comments, things that you wanted to say about the things that you heard today. And definitely I'm looking for more examples of how it is that you take care of yourself to stay in this work. So like myself, I'm praying all the time, for myself and for everybody around me, quite frankly. But I also do yoga, right? I have to do something physical because this work gets in your body. And so let me see, do I need to call people out? What do you do to take care of yourself, to make it so that you can continue to serve our communities? Yes, please talk.
Hello, good afternoon, everybody. To introduce myself, my name is Erin Balisea. I am the program assistant for True Life, a anti-gun violence nonprofit here on Staten Island. I'm gonna say the sidebar, I'm not from Staten Island, I'm from Brooklyn, had to put that out there. And coming to Staten Island, not knowing anything about Staten Island and learning about honestly speaking, the problems on Staten Island, I was like, oh, sweat. It's just like the other boroughs. Like you, honestly speaking, you would never know until you move here because everybody calls it the forgotten borough. So we deal with a lot of basically everything you said. We have outreach workers, our hospital responders, we have the entire CMS model. So it's constant either shooting responses or somebody's getting locked up or somebody is losing their house or needs help with housing or didn't eat today. There's always something constantly reminding you that, hey, that can be you. It could be one bad check and it could be you coming in here and talk about, hey, do you have any food for the pantry? Do you have any pads? Do you have any socks for my kids? There's things that people ask for and ask for certain resources, and it's absolutely heartbreaking. So what we do is we're actually mandated to talk to a therapist once a month. And then what Mike Perry, the program manager, likes to do is he likes to keep everything super family orientated. So it's like an open door policy. We could literally go and talk to him about anything and everything without trying to put our entire souls on him as if he's not already busy. And then personally, what I do is I just had my daughter, and literally teaching her sign language and being with her every single day has helped me refocus and recenter myself from being on maternity leave, feeling like I wasn't doing anything and I'm a horrible person. How can I leave work? And then coming back to work and being depressed, like, oh my God, I'm leaving my daughter. I'm a horrible mom. So trying to balance out those two people, my daughter has been helping me with that. And she's absolutely hysterical. She's 4 months and you're going to see her on Comedy Central because that little girl is hilarious. That's definitely what I do to center myself and to help myself heal. I try to make sure that the stories that I see every day and the traumas and the neglect that I see for certain populations, my daughter doesn't end up being one of those people. And I'm trying to be the best parent I can be.
Excellent. So I love all of that you shared, Amber. And I'm hoping that the conversation on epigenetics will just have you see how the time that you spend with her is awesome and is doing everything that you wanted to do. And as shout out to you for teaching the baby sign language.
Thank you.
And so what I hear is therapeutic, like talk therapy. I hear spending time with loved ones, especially babies. Like, who doesn't feel good after spending time with babies?
Like, hello.
This is good stuff. Gary, you wanted to say, is that a young person? I'm looking at a young person on 100 suits. So I will always want to hear from young people. But go ahead, Gary.
Yeah, I'll go, because you asked what do we do? What was the question again? What do we do to
take care of yourself?
Take care of myself.
Make sure that you can continue working and be optimistic and positive and all of that.
Yeah, well, I step away from, my day-to-day stuff by doing other things that I'm interested in. I'm a content creator. So I have other content creators. I'm a tech person, so I'm a content creator. So I have other internet content creators that reach out to me, you know, to work on different projects and everything. I have a record label. I didn't realize my camera wasn't on. I have a record label where I deal with a lot of different, you know, artists, industry artists, producers. And so, you know, I'm in the studio working on different projects and stuff. That's my solace. You know, I'm a gamer, you know, so, you know, I do a lot of, you know, modifying files related to gaming in order to modify different gaming. I'm teaching myself how to code by learning how to you know, modify game files. So I have a lot of different interests and things that's you know, how they say, when you're doing what you love, it's not work. You know, so I have a lot of things where, you know, I'm doing what I love, and that's my solace. That's my you know, that's my woosah, you know, me doing some of the other things that I'm involved in, you know, related to, you know, helping people or building my brand, you know, things like that. And then, you know, outside of all that, I just get some rest. I shut everything down. I get some rest. Go to sleep.
I love that, right?
I
So
will,
the first
trust
thing you
me,
said is like, I take a break.
yeah, I will stay in bed all day under the covers with my I got my laptop. I got 17.3-inch screen gaming laptop. I spent over $3,000 on it, investing all together collectively with making sure I will lay in my bed with my laptop right there, phone off, and I'm just in my zone.
Listen, that's what we got to do, right? We have to do something, right? And so I hear what I heard you say is you get rest, definitely, and you got a hobby, right?
Yeah, I have numerous hobbies.
Something that can take your attention away from all of this
exactly.
stuff, right? And it feels good and makes you feel good.
And you know, and oftentimes they're not with me because, you know, I consider myself a dynamic person because of all of the different, you know, things I'm involved with. And sometimes, you know, I may be dealing with a crisis or a problem, you know, professionally, you know, with what we're doing, with me stepping away and doing something else. I'll be doing something else totally unrelated that'll trigger the answer, that'll trigger the solution to the problem that I'm dealing with in another area. So sometimes just walking away, you know, will you know, you just never know where you know, where that answer, where that solution may come from.
Yes.
You know, I remember one time I was working on.
Hold on, Gary. It's time for us to wrap it up, right?
Oh, it's time to wrap it up.
Yes.
Okay.
So thank you for all of that you shared, though. That was really good, very powerful. And so, you know, I like to end these sessions, or at least this first session, with self-care, right? We're gonna go into a weekend. You got exposed to a bunch of information today. Some of it you already knew, and some of it is like, man, we talk about this again, but what are we gonna do about it? Where's the solution? I promise you. The conversation on solutions was just had, because we have to, how do you eat an elephant? One bite at a time. Right, so your self-care is super important, because I need every single soul that's here to pay attention to this issue. But this issue will cause you to get burnt out, right? Because we can't really step away from it. When I go outside my house, I'm in the same neighborhood that was redlined and all of the things. So I don't really get to get away, but I do get to take care of myself so I can stay in the fight. So thank you for everyone that shared their self-care. And I promise you that if you do something for yourself this weekend, you're gonna feel really, really good. And please, do something for yourself this weekend. This is a extended weekend. There's a so-called holiday on Monday. All right, I can't even get into like how that holiday plays into structural violence and where, you know what I'm saying, in my life, you know what I'm saying? I can't even,
It was structural from the beginning.
Right, this part is over, right? So let me just remind us, you see what we're living in, right? We literally have a holiday that is the example of the things that we're talking about.
Celebrating pillaging and rape.
So what I'll say is, everyone enjoy your day off, right? so that you can get the respite that you need and the rest that you need so we can come back again for the good fight. So I usually end these sessions, we're beyond time. And so I just want to acknowledge that I'm aware that we are beyond time. But I usually do end these sessions by playing like a music video or something just to help us transition out of this conversation into the conversation that we want to have next. So I do have something that I want to play. You do not have to stay, right? For this part, if you have somewhere else to go, some people have already left. These sessions are recorded. And so ideally, I will be able to share that recording with you in the future. But it's not going to be this weekend. I don't think we're going to get that. So, but if you want to stick around, I do have something I found online that I felt that I just wanted to share because that's what I do. And with that, let me just pull this up so that I can share it. It's for the sake of us having fun today, right? So it's not exactly related to the content, but love is love. So I'm gonna share, hold on, no, that's not it. But did you see Luther?
I love me some Luther.
And I was like, wait a minute, Luther was.
I echo that.
Luther was part of this thing. Okay, go back to the app, Mitra, so that you can share with the video.
I think everybody owes Luther a bit of gratitude for why we're here today.
Like, you know what it took to get us here? All right, anyway. But he's introducing this guy. So
as I walk through the valley of the shadow of death, I take a look at my life and realize there's nothing left. Cause I've been blasting and laughing so long that even my mama thinks that my mind is gone. But I ain't never crossed a man that didn't deserve it. Me be treated like a punk, you know that's unheard of. You better watch how you're talking and where you're walking, or you and your homies might be lying and choke. I really hate the trip, but I gotta look. At the coke, I see myself in the pistol smoke. Fool, I'm the kind of cheater little homies wanna be like on my knees in the night, saying prayers in the street light. Been spending most our lives living in the gangster's paradise. Been spending most our lives living in the gangster's paradise. Look at the situation they got me facing. I can't live a normal life. I was raised by the state, so I gotta be done with the hood gene. Too much television watching got me chasing dreams. I'm an educated fool with money on my mind. Back 11 in my hand and a gleam in my eye. I'm a loped out gangster, set tripping banger. And my homies is down, so don't arouse my anger. Fool, that ain't nothing but a heartbeat away. I'm living like do or die. What can I say? I'm 23 now, but will I live to see 24 the way things is going? I don't know. Tell me why are we so blind to see that the ones we hurt are you and me? Dissipation, race relation, constellation. Been spending sincere.